Okay, so we always start with the upper design. So then, of course, whenever we overlap, because we overlap the denture with the picture, bringing the ridge, right? The ridge is overlapped with the denture, and then we overlap the denture with the pictures. Denture is giving me reference on the picture also, right? Exposure, lip support, right? So I can take the profile picture, understanding if the support is good in this, in the profile view. So the denture is something that, so I bring the denture. So I decided in this case, I don't need to gain lip support, in my opinion. I didn't need to gain a lot of lip support, okay? She seems to have a good lip support. So I want to keep kind of the teeth in this position where it is. So then I bring the denture, and when I'm designing, I have the denture as reference, right? Okay? So we did the design. Every time we are doing the design, we bring the picture in, of course. So designing the case again, of course, we have freedom, but not complete freedom, right? We need to understand where the ridge is, because since we're gonna be putting implants, I cannot go wild on how much I expand, for example, right? I need to kind of respect where the ridge is, because if not, the implants will be off the arch. And we always confirm this when we bring the design into the CBCT, of course. So when we are designing, we don't have the CBCT at this moment, but I have the ridge, so I can understand, right? So it's kind of respecting. Of course, if we have as much high as we have more freedom, because we're going to have the transition with the flange, with the pink, right? Okay. So we designed the upper. As always, we simulate the pink also, okay? She doesn't show much on the smile. I believe she smiles more than that, for sure, whenever she's more confident, okay? And then we decide about the lower. So we bring the lower in, and then we start understanding what needs to be done on the lower, okay? Of course, her lower, we were also understanding the situation of the teeth, right? So the teeth have some important perio problems on the front. She already lost the teeth on the back. So we kind of, when we started evaluating everything, we kind of, with Jesus, we kind of decided that this would probably go for a full over implants on the lower also. Okay, so when we see that, we have more freedom to design the lower also in the ideal position. Because if we decide to keep the teeth, we have to respect the position of the teeth to design the case, right? But we did see that she probably needed an increase of vertical, right? And so we did increase 2 millimeters, okay? To design the case. And then we designed the lower arch.
Does laser going to go for the lower arch today, or?
No, so that's...
Yeah. What are you going to do? Are you going to put some composite to...
Yeah, I'm going to talk about this. This is a very good question. Because if we compare the ideal upper with the current lower, you see here. Okay, so we're gonna adapt. We're gonna make a transitional kind of. Okay, so what we do usually on cases like this, and many clients they ask for that also, is no, I understand we need to go for the lower, but it's not gonna be now. So for the surgery, the immediate loading, I need you to try adjust as best as you possible the upper design to her lower actual. Okay, so we did that also. So I made some small modifications on the lower, especially on the occlusal, to make us have less work on the lower at this moment. So, but we still have to do something because we have to adjust a little bit. So, but then I will adjust on the lower because we're gonna. Yeah. So I will adjust the right side on the lower, and here was too far. If I adapt the upper on her current lower here, I'm gonna have to bring the occlusal plane too much down, and we will impact considerably the aesthetics. So whenever it's like too much like this, then we have to make decision. Some dentists, they ask, no, it's okay, adapt. Adapt. And I say, okay, we adapt. Because then for the final, I will correct this, I will do the lower, so then we put the occlusal plane. But I like the provisional to be as close as possible of the ideal design always, right? So what we're gonna do here is add some composite. She has a remove on the lower. So we're gonna build up some composite on yeah, very easy on the low. So then the lower arch, okay, with the pink also. Let's remove the upper. Okay, so this is gonna be her lower arch in the future. Okay, so we see here the amount that we would need to adjust on the lower. But since I adapt a little bit, we're gonna have to adjust less, right? And we don't need to adjust the buccal, just the occlusal, right? Okay. Okay. Then, after we get into an agreement about the final outcome, because this is the final outcome, right? So this is what we think is the best for her to end up the treatment. Then we start deciding what needs to be done, right? On the upper is clearly implants. Then we start planning the implants. So whenever the design is decided, ideally, so with you guys, we send the design first always. We always send the design. You guys need to approve the design or ask for any modification, right? Until we agree on the design. Once the design is done, agreed, then we bring it to the CBCT, and then we start planning the implants. And then if we see some limitations, we can always go back to the design if needed and adjust here or there, right? But usually, no, this is not needed, right? But it can be done, okay? And on the lower arch, we bring also the design to the CBCT, and we confirm the teeth are out, so we plan the implants. Okay, it's very important on this stage to at least show all the simulations to the patient. So that's what we send with the presentation, the interdisciplinary one. We send the design and we send the simulations also. So you can explain to the patient the need of implant, why those teeth need to be, it's not worth it to keep it. Then you show the simulation of the implant so the patient understands, and then you explain the treatment, sell the treatment, the patient agrees, and then you start the treatment, right? Whenever you're starting the treatment, you can decide staging the best way you want. So in this case, for example, you can decide, okay, the patient understands, she needs a lower also, but maybe she wants to wait, maybe for financial reasons, maybe because the treatment, it's too much for her to go from upper and lower at the same time, so whatever reasons. It's a course. So you can decide staging, as we did. So we're going to do the upper first, and then on the future, the lower. Okay? Oh yeah, that's important. Yeah. The mock-up. What can we do for dentist patients for the mock-up, right? There are two possibilities. If the design is mostly additive, and many times is, because the dentures are usually, we can just use the denture and transfer the mock-up as we do over teeth. So bisacral, transfer, and place the old denture in the mouth and take a look on how it looks. Or we can print provisional denture, or we call a mock-up denture, which is what we did here. So since I had, let me see where it is, motivation. Since I had the information of the old denture, the flange from the old denture, that's another important or good thing about relining and scanning the whole denture, because I have a flange already. I have something there that I don't need to build up a new flange, and this generates work from us. So we will have to charge or extra for that. And if we have the flange from the old denture, we use this to create the new denture. So the flange, the pink part. So this part here, that you see here, is from her old denture. It's a copy of her old denture here. And we only changed the teeth. So we trim the part where the teeth are, and we keep the pink part. Okay, so, and this is an STL, and you can print in tooth color material. You don't even need to add pink. If you want, you can add a little bit just to simulate the papillas, but here's not the most important. What you need, what you want to check, not only to impact the patient, for her to also confirm if she likes, but you also. Occlusal plane, midline, exposure, everything is okay, or we need to change something, right? All very important things to confirm. So let me see if I... So you see, this was the old denture. Then we kept the soft tissue, you see? It's the same. And this is what we print. Okay? So, let me erase the model. So you see, it's the relined denture. Okay? And I'm 100% sure that this will fit perfectly on the mouth. Toof. Okay? And that's what we printed, and that's what Jesus tested on her. Okay, so this is the static test test drive. Okay? We usually, in maybe 90% of the cases, it doesn't make sense to do the lower markup unless you want to test drive function. So it's another test, unless one of the main complaints of the patient is the static of the lower, right? So we need to understand the patient. Some patients, they show a lot the lower teeth, and it's something that bothers them a lot, so we can do the markup. On her case, I would do a normal conventional markup over the teeth, if that was the case, okay? So transfer this with Bisacro, okay? So we have to bring the design from the lower, adapt to be able for you to transfer to her mouth, and then you can place it and test drive. Okay?